Background of this study is that there is still an issue about how we should do a vessel prep in peripheral arteries. What is the ideal method, especially in combination with a drug-coated device, because the vessel prep is important for the drug uptake. The method of vessel prep is important for drug uptake. And this is even more important in below the knee than above the knee. So we have, because below the knee arteries, there's a lot of issue with regard to adequate vessel prep. The lesions are usually longer, the vessels are smaller. And so if you do a vessel prep just with Bobo, which is the standard of care, I would say, then you have a high rate of recoil, acute recoil, a high rate of dissections, which is influencing the outcome of the procedure. And this is not only the outcome with regard to lumen gain, it's also influencing the outcome with regard to drug uptake. So this is an issue. And therefore, I think an adequate vessel prep system is very, very important. It should be easy to apply in below the knee arteries. I think still a lot of people have some kind of fear with regard to atherectomy because they fear the complications of atherectomy. And so it's an easy to handle method, something which is like angioplasty or a more advanced angioplasty technology. I think this will also be adopted by the physicians because it's something they know from their daily practice. And therefore, the rationale for this study was to look how this spur stent system, who is making incisions and spikes the artery, the inner arterial wall, how this spur stent system is increasing at one point the acute luminal gain, on a second point might be responsible for an increasement and better drug uptake. Just to summarize, you deploy the spur stent system, and with the spikes on the spur stent, when you deploy the spur stent, you spike the inner arterial wall. Spikes going into the arterial wall, and therefore you have penetration holes these penetration holes are responsible for the acute luminal gain, and because you can better open up the vessel is more reactive. And the second thing is that you might have better drug uptake through this technology. We are doing a pilot study with around 30 patients here at our site in Graz. We have already included 11, and we will include some until the end of January, some additional ones. And the endpoint is for sure, first of all, at 30 days, the acute luminal gain and the safety endpoint. And at 6 months, it's the primary. It's a composite. It's the primary efficacy endpoint with regard to to show that there is no clinical driven TLR at 6 months, and you have still an adequate lumen gain, so that there's no restenosis. For us, the first thing is that we were impressed with, right away from the beginning after the first patients, from the acute success, from the acute luminal gain we are able to achieve. It's really eye-opening how the vessel is responding to this kind of technology. It's really, really very impressive, very impressive. That's the first thing. The second thing is that the device is an easy to handle device. So this is what we like it doesn't prolong the time in the cath lab. And as we have now in the meantime follow-up, some months of follow-up for our patients, we have not seen any safety issue at 30 days. We have not seen any acute reocclusion. And what we're really impressed in the 6-month patient cohort, we have in the meantime 2 patients where we have a follow-up of 6 months. We see the sustained success with regard to luminal gain, and there is no restenosis, and the vessel looks in a critical lymphedemic patient with below the knee disease. The vessel looks like just after the procedure, and this is really very impressive. I think the next steps should be to look at this in the randomized controlled study, just to show that it's really that it's really superior to the standard procedure, which is BOBA, or you can also use other kind of vessel prep technologies, and maybe to compare different drugs. So this is something we have to discuss with the sponsor. What are the next steps? But I would say really to make a randomized controlled study where it is able to show that the comparator, which is BOBA, is not the adequate vessel prep system in below the knee arteries.